I've been asked to address some of the questions that have arisen about the relationship between coronavirus and the heart and heart disease. And I'm going to give some guidance which I hope you'll find useful. It should be understood that knowledge about this new virus is really currently quite limited, although it's improving day by day as some of the excellent research and clinical studies being done around the world are becoming available. Considering the relationship between coronavirus and the heart, we can think about it in one of two ways. One being how the virus affects the heart, and the other being how having underlying heart disease might affect one's likelihood of contracting and the severity of the illness that you get with coronavirus. With respect to how coronavirus affects the heart, we should remember that in 4 out of 5 people, coronavirus causes only a mild illness, and there may be no symptoms at all. But in those few that get it moderately or severely, we know that there can be heart involvement in up to 40%. People with atrial fibrillation often find that if they're unwell, particularly with a fever, they get increased episodes. And so this may be the case with coronavirus, but it's important to know that this does not mean that the coronavirus is necessarily affecting you particularly badly. Atrial fibrillation can occur in some people with known underlying heart disease, and in particular coronary disease and high blood pressure, both of which are quite common. There is an increased risk of the effects of coronavirus. It doesn't necessarily mean that you're more prone to catching the infection, but the effects can be more severe. Regarding anticoagulation in atrial fibrillation, should you get coronavirus, the answer is that you must continue your anticoagulants and not stop them unless advised to for good reason. Understandably at the moment, nobody wants to go to A&E or attend a hospital if they can possibly avoid it. And so if you have an episode of atrial fibrillation, the thing to do is whatever you normally do at home and stay at home if you possibly can. Obviously, if you become particularly unwell with it, then yes, you may have to go to A&E. But really, it doesn't matter how long the episode goes on for, providing you remain well, you can and should stay at home. Some patients on warfarin for their atrial fibrillation will be offered the opportunity to change to one of the newer anticoagulants. And this would seem a sensible thing to do because that avoids the need for INR and attending medical facilities. One of the questions asked is whether any special measures are needed if you have atrial fibrillation in respect of protecting yourself or protecting others or protecting the NHS from coronavirus, and the answer is no. You just follow the usual guidelines just like anybody else and look after yourself, look after others, and look after the NHS. There's no need to modify those rules.